So, in situations where treatment, withholding, withdrawing, however we want to term it, is happening, as physios in your role, do you ever get involved with that? Yeah. And can you talk to me about how you're involved and how that feels?
If we're organ retrieving, then we need to keep the lungs nice and clear to take their lungs. So if they're still ventilated, if they've got any secretions or anything on their lungs, we'll be involved in making sure that their lungs stay nice and clear, or to clear their lungs in the enable, and that can be quite hard.
And it tends to be something that we will do as the seniors. So
yeah.
Certainly I tend to get a handover in the morning and allocate the patients to the team if I'm off. Karen does it, and I'll make sure, and you make sure, that it'll be something that we always do. We don't tend to give that to the junior staff to do, because I know from the years we've done it, those patients tend to stick in your head. Like, I could give you examples of the times we've done that over the years. Quite often that we'll know early on, if the organ donation nurses have been involved, we can say, are you looking at taking heart and lungs? And they'll say to us at that point, yes or no. So if they're not taking the lungs, we just step back at that point. We're not involved any further. If lungs are involved, then we'll straight away be involved, and quite heavily involved sometimes. I don't know how many years ago.
It feels like only yesterday, but it's probably about 10 years.
But they had said they were going to use her lungs, and she did have an infection, so we worked on her, and to sort of try and clear her lungs as much as possible, and didn't use them in the end. And I can remember being really disappointed, because you just think, you wanted them to go to save somebody else, and you knew she wanted them to go to save someone else. You sort of think, oh, I failed a bit there. Yeah. Because we just couldn't get them clear enough that they could use them.
And her family were very good, because some families find it very difficult, because they can't understand why you're still doing physiotherapy. If my son or my husband or my wife is dead, why are you
and told us they're dead.
And you're told us they're dead. Why? What are you doing? Why are you still doing this?
It's a difficult thing to.
And physiotherapy looks unpleasant. It doesn't look, it's not something gentle, that someone's coming along and gently doing this, or washing them, or doing something that they feel is a nurturing thing for their loved one. It looks like it's brutal and invasive, so I think it's quite a hard, and we've tried to treat them very early before the family get there, or so we try to quite inintrusive, or if they're doing a roll, we'll nip in and treat their chest while the family are out, to try and not be obviously giving someone physiotherapy at a time, especially because a lot of families don't quite understand what physiotherapists do.
They see it as rehab.
Yes, they do.
It's always seen as being rehab, so anything that sort of goes against that, people don't understand.
No. So they can, it's quite a difficult one. So we try and be mindful of that, and try and treat at times when something else is being done, so the family aren't aware of what's going on. Really. With that family, they were very on board. They knew exactly what was happening. They were very.
It's not a nice thing to do as a physio. I can remember having a 15-year-old boy with us. I don't know why he was with us and not peds. No. I think because we knew he was brain dead coming in at a massive subarak. I can remember you were off, so I ended up treating him on my own, and that has stayed with me, because he was a young 15-year-old as well, so he was like treating a child rather than a young adult. So those treatments stay with you. I think they're not nice. But I think we're doing them more and more.
And I think it's hard sometimes here, because we don't do organ donation. We don't see the other side of it. No. When I worked in London in Great Ormond Street, I worked on the other side. I saw the recipients of the donation, and that's a delight. I mean, it can be sad because some don't make it, but it's a delight. It's an absolute joy to watch someone that, a young cystic child that's not been able to breathe, run down a corridor, kick a football, do those things, and that's an immense thing. But here, unfortunately, we don't have that side of it.
Occasionally you get a letter, don't you, that's stuck up in the staff room, and you sort of see they'll send a letter to say how many patients have sort of been saved because of the organs, and thank you for your work.